Imagine opening a hospital bill for $18,472. You had insurance, you already paid a copay, and now the statement says the full balance is due. Do not let the size of that number rush you into making a decision. A hospital bill can include charges that are legitimate, charges that need an explanation, and sometimes information that has not been updated correctly. Before you pay, put 3 documents side by side: the bill you received, a detailed itemized statement, and your insurance explanation of benefits, usually called an EOB. In this video, you will learn 7 red flags worth checking and the exact questions to ask the billing department. A red flag does not prove that a charge is wrong, it tells you where to slow down and ask for an explanation. This video provides general educational information. It is not medical, legal, insurance, or financial advice. Coverage, assistance programs, and billing rules can vary by plan, provider, state, and individual circumstances. Do not ignore deadlines, collection notices, or appeal instructions while you review a bill. Start by calling the provider's billing department and requesting a detailed bill that lists each item or service and its cost. If you used insurance, get the EOB for the same visit from your health plan. Now check these 7 areas. Red flag number 1 is the same charge appearing more than once. Look for identical descriptions, billing codes, dates, quantities, and dollar amounts. Pay special attention when you received care from several departments or more than one provider. A repeated charge is not automatically an error. 2 tests may have been performed at different times, or separate professionals may have provided related services. But if 2 lines look identical, ask what makes them different. Use this question: I see the same code and amount twice on the same date. Can you explain what each line represents? Mark both lines and write down the answer. If the billing department says one is a duplicate, request a corrected statement in writing. Red flag number 2 is a medication, test, supply, or service that does not match the care you received. Compare the detailed bill with your discharge paperwork and, if needed, your medical record. CMS advises patients to ask for their records and compare them with the bill. You should not be billed for something that is not documented in those records. Be careful here. You may not remember every medication or supply used during an emergency or while you were under anesthesia. Treat a mismatch as a question, not an accusation. Ask, where is this service or supply documented in my medical record, and who ordered it? If the provider cannot connect the charge to your care, ask for a formal review of that line. Red flag number 3 is information that does not match the visit. Check the patient name, date of service, provider or facility name, and the quantity beside each charge. A quantity of 10 when you received 1 item can change the total dramatically. Also remember that 1 hospital visit can generate separate bills. The hospital, emergency physician, radiologist, anesthesiologist, laboratory, or ambulance service may bill separately. A different provider name is not automatically wrong. The question is whether the date, provider, and quantity make sense for the care documented. Circle anything that does not match and ask the billing department to explain it in plain language. Red flag number 4 is a billing code whose description appears inconsistent with what happened. The detailed bill may show codes instead of familiar names. CMS recommends looking up each medical billing code and comparing the description with the care you received. Do not diagnose a coding violation yourself. Medical coding is complicated, and separate facility and professional charges can be valid. Your goal is to identify something that deserves clarification. Search the code with the words medical billing code. Then ask, this code appears to describe a different service. Can your coding team confirm that it matches my record? If several charges seem to describe parts of one service, ask why they were billed separately. Avoid accusing anyone of fraud or unbundling. Simply request the written explanation and the coding review. Red flag number 5 is one of the most important. The amount on the provider's bill is higher than the patient balance on your EOB. An EOB is not a bill. It is a notice from your health plan showing the provider's charge, the plan's allowed amount, what the plan paid, and what the plan says you may owe. CMS says your provider bill should not be higher than the patient balance shown on the EOB. If the EOB says $2,184, but the provider bill says $18,472, stop and compare the claim number, provider, and date of service. The provider may not have posted an insurance payment or contractual adjustment yet. The bill may relate to a different claim, or the claim may still be processing. Also, subtract any copay or deposit you already paid. The EOB may show patient responsibility without knowing that you paid part of it at the hospital. Call both the provider and the insurer. Ask the provider whether all insurance payments and adjustments have posted. Ask the insurer whether the claim is final, pending, or denied. Red flag number 6 is an unexpected out-of-network charge, especially after an emergency or care at an in-network facility. For most people with private insurance, the Federal No Surprises Act protects against many unexpected out-of-network bills for emergency services. It also covers certain non-emergency services from out-of-network professionals at an in-network hospital, outpatient department, or ambulatory surgical center. Out-of-network air ambulance services have protections as well. When the law applies, your cost sharing generally cannot be higher than the in-network amount. But there are important exceptions. Ground ambulance services generally are not covered by the federal protections, although state law may help. Medicare, Medicaid, Veterans Affairs, TRICARE, and other programs have separate protections. Some insurance products are also outside these rules. Do not assume that every out-of-network bill is illegal. Ask your plan whether the No Surprises Act applies to this specific service. You can also contact the Federal No Surprises Help Desk at 1-800-985-3059. Red flag number 7 is a balance that does not show expected insurance adjustments, discounts, payments, or financial assistance screening. If the provider has not submitted the claim, ask when it will be sent. If the insurer denied the claim, read the reason on the EOB. You may have the right to file an internal appeal, and the notice should explain the deadline and process. If the bill is accurate but unaffordable, ask about financial assistance before agreeing to a payment plan you cannot manage. Tax-exempt nonprofit hospitals are required to maintain a written financial assistance policy. Eligibility depends on that hospital's rules, and not every doctor or outside provider is necessarily covered by the hospital's policy. Ask, does this hospital have a financial assistance policy? Which providers are covered, and how do I apply? You can also ask whether the provider offers a reasonable payment plan or another reduction. Do not assume you qualify, but do not assume you are ineligible either. Here's a simple script you can use when you call the billing department. Hi, I am calling about account number ending in 4217. Before I make a payment, I need a detailed itemized bill and an explanation of several charges. My insurance EOB shows patient responsibility of $2,184, but this statement shows $18,472. Please review whether all insurance payments and adjustments have posted and explain the highlighted line items. While the account is being reviewed, what happens to the due date and collection status? Please give me a reference number for this call and tell me when I should expect a written explanation or corrected statement. If affordability is the issue, add, please send me the hospital's financial assistance policy and application before I agree to a payment arrangement. Write down the date, time, representative's name, reference number, and promised response date. Keep copies of the bill, EOB, records, letters, and notes. If you send documents, send copies, not your originals. Before paying a large hospital bill, check for duplicate lines, undocumented services, incorrect dates or quantities, code mismatches, a bill that exceeds the EOB patient balance, unexpected out-of-network charges, and missing adjustments or assistance options. The goal is not to avoid a legitimate bill. The goal is to understand exactly what you owe and why. Save this video so you can use the checklist when the documents are in front of you. Subscribe to Care Costs Unpacked for the next guide, where we will explain what to say when a bill appears correct, but the amount is still unaffordable.